Take away to that crown?
Yes.
What's going on? Your body hurts?
Yes, and I have to water pick to get the food from Entertainment. Yeah.
Okay.
So, yes.
Take a quick look at all that.
It bled today when I water picked it.
Uh-oh.
Yeah.
So does it hurt, or is it more just...
Yeah, it's like anything I eat, every time I eat something gets stuck in that
So
spot.
it's a fact. Okay, so stuff's getting stuck in there more so.
Yeah, it's everything. Anything.
Let me see the contour. Is it between that last tooth and...
It's
is
at
it
the
between
top.
the space?
It's at the top left. Top left. Right behind the canine tooth.
Yeah.
I can show you. It's just really that crown. I know that area.
I remember that was the one where we had to throw a Hail Mary on it, right?
Yes, I had to come in 5 times
to get that purpose, right?
Yes.
Yeah, I'm looking at it. It looks pretty flawless. I think as flawless as we could get it.
Oh no,
given the
Dr.
circumstances.
Charles.
Let me take a look. Let me take a look what it is. Because
Okay.
it's pretty flush. You can see it on the X-rays. It's
Yeah.
like flush with everything. So I remember being like, Rob, I'm not trying to extract this tooth. Let's go ahead
check
and
it out because it is.
put our cape on.
Have to
be a
save the day
superhero.
again.
But let me take a look. Let me take a look. See what's going on.
Okay.
So we've got 2 crowns. So you can notice, this is the one we did. Notice how short this one is. Notice this big old puffiness here. I'm sure that's kind of tender. And then it stops being puffy right about here, right? It stops. It doesn't hurt as much here, right? Because the margin is where it's supposed to be, which is right at the gum line. But when you go here, the margin's way in here. You know what I mean? Like it's down here is where your crown ends. Shouldn't be that way. So we may have to kind of reduce a little bit of this gum tissue to expose that crown. But so that's why this tooth looks longer. This tooth looks shorter. It's just that the crown we did, of course, is doing well. Notice the bleeding around the other one behind it. We have to like take care of like your gums there, or replace the crown that was there.
What do you recommend? Which one?
I would say go conservatively and reduce the gums a little bit. By conservatively, I mean like not cutting off the crown and all that stuff. Reduce the gums a little bit. See if it subsides. If not, then we may have to remove the crown and do a little bit of like periodontal management. Excuse me, and put the margin so it's like comfortable. Because what's happening is like you're just not able to like, it's just too deep.
Yeah, and food gets stuck there all the time.
Yeah, and if you don't water pick, there's no way it's gonna.
Yeah, and I was like, use floss.
It's
I'm
like throbbing,
I can't.
right? It's like throbbing, yeah. So
the water pick we got here, I think a year or so ago, I've been using that.
Yeah, I can tell. Like the rest of the teeth.
You see how I take care of that teeth?
Well, you can, when you look at X-rays from like before, you always see the progression. You're like, calculus, no calculus.
Yeah.
So, I always like get excited when I see people come back and then their gums aren't puffy everywhere. It's just
that one.
Yeah, it's just that one spot. So that's what I would recommend. Go conservatively and then see what happens. Because either way, if we have to redo the crown, we have to reduce the gums in that area anyway.
Okay.
So I would say do that, and then because it looks like most of your irritation is like your gums have overgrown a little bit because of where the crown margins are. So we can reduce the crown margins where your gums are lower to where it should be. If we're within, your body has to maintain a certain distance. If that distance from the bone is violated, then everything goes whack. So we'll bring it back to where it's not violated, and then we'll assess it from there. That's what I would recommend to do.
Okay, so
actually the crown behind.
So it's not your work. Oh God.
It's the crown behind the one we did. So because they share, contact.
Yeah.
This one's okay when I probe around it, but when I probe from here, and as soon as I get to here, it hurts.
Yes.
But from here forward, it doesn't hurt as much.
Oh my gosh! Don't tell me that.
Let me just take a look, because that's why that tooth looks shorter than the other one. So this is the regular, so we're getting 1, 1, 1, 2, 4, 4, 5, 5, 5. So yeah, right about here is where the bulk of them. So we can take the. Okay, so we can. What I would recommend, you may be able to just leave the same crown you have behind that on there, but we would just take the laser. We'd have to take the laser and reduce your gums because that pocket is too deep around that other crown, and it's starting to affect my work.
Yes, I'm like, Dr.
So the one behind the one we did is there's a pocket around it. So it's mainly what we call super bony, meaning that like your gums are just overgrown a little bit. So hopefully we can reduce it to adequate length, and I'll reduce it as it approaches the crown we did. So I don't want my work to start.
Yes.
So we'll reduce both of them, and it should heal pretty well. At worst, you may have to have the other crown redone because what it is like it's kind of like they pretty much made the margins of a crown far under your gums, and then your gums don't like that, so they get puffy and irritated and creep up even more. So if you look like you're still being numb and you're like not biting consistently, so I would say the best thing to do is to take it out for a test drive the next 2 days or so. You know our number. Come right ahead if anything feels different. It only takes doesn't take long for us to make any adjustments. Because I don't want to and then I'm like, oh, that's not her bite, and I'm over adjusting in one spot that's not actually your bite, and then it's like, oh, but it's still, and then I'm like, okay, we're gonna have to cut the crown off and do it again because we've over thinned it out in the wrong spot, So that's what I'm saying. So I would check it out for like a day or two, and then if you feel like, oh my god, every time I'm chewing like something is completely off, just come back in. It don't take as much time. If we, God forbid, we have to cut it off and make a new one, we will. We want you to be happy.